The video you're about to see is going to show you how to read, how to interpret, and how to get a National Registry question right. If you're not reading questions like this, I'd invite you to join me in my live online review sessions weekly as part of EMTreview.com and ParamedicReview.com. I go over questions just like this. We spend time every week doing it and teaching some of the information around those questions to give you a better knowledge base. I'm Dan Limmer from Limmer Education. I hope to see you online in my sessions. All right, so we've had some time to look at this question. Let's go over it. Let's get to the bottom of this and get the best answer. So we have a 9-year-old patient. Remember, I said always pay attention to the age of the patient. So we have a pediatric patient who was struck by a car while riding their bicycle. So they have pain in the left forearm, right shoulder, and belly. Skin is pale and cool. Right shoulder appears uninjured. So the forearm is angulated. Right, that's not good. Distal pulses are present though. All right, good. They have an abrasion to the right upper abdominal quadrant, and the pain increases with palpation. You should perform spinal motion restriction, and we have choices: splinting, realigning, splinting, oxygen, and transport. So what's going to help us differentiate between these things? Well, hopefully you read this question and you said, oh, this kid is sick. There's always little things sometimes that are easy to miss. So the first thing you should look at, even before mechanism of injury or anything else, is this pale and cool skin. That's really significant, right? The mechanism of injury, yeah, that's really important, right? She's got a gnarly wound to her left forearm, but her right shoulder hurts and her abdomen hurts, but the right shoulder appears uninjured. There's right upper abdominal quadrant pain, and look, the right shoulder hurts. Isn't that sometimes where pain is referred to from subdiaphragmatic organs? Organs under the diaphragm sometimes have pain that appears in the shoulder. So is this a shoulder injury because it appears uninjured, or is it a result of her right upper abdominal quadrant? What's in the right upper abdominal quadrant that's a solid organ and can bleed a lot? Ooh, the liver, right? So now if I take pale and cool skin, that right shoulder pain, the right abdominal quadrant pain, I don't need vital signs in a 9-year-old to tell me this kid is really sick. So if you pick those things out of the question, you're great. You're going to say, what's the right answer? I'm going to administer oxygen and transport immediately, right? Because yeah, she has an angulated arm. You're going to might straighten it out, and you might get her on a backboard from the road and then get her to the stretcher, right? So you can do some spinal motion restriction on the stretcher. The arm has pulses present. So while it's gnarly, it's not as serious as the fact that this kid is, like we've seen in other questions, this kid is sick. So we don't fool around. We don't splint their arm. Who cares what the physician found and put a cold pack on, right? Gently realign and apply a splint. Splint their left arm. That's called splinting a patient to death. When you start addressing musculoskeletal injuries, which are gnarly but inconsequential, and you miss shock in this sick patient, you've missed the point. There's 3 things that we need to do in a National Registry question. We need to identify all the things that are important, and we underline those. We need to evaluate what they mean. We evaluate all those things, and then we place value on what's more important, right? The left forearm, that's important, but it's not that important when we're combining and when we're treating for shock. So we identify all the issues, we evaluate what we think they mean, then we put value on the most important things. Again, this is just like we do on the street. I'm so sick of people saying the National Register is nothing like the street. This looks for the clinical judgment that I would want in my EMT or paramedic that I was training. And it's why these questions are valuable. And if you read them carefully, identify, evaluate, and then place value on the most important things, you will, in fact, pick the correct answer.